Hello, everyone. Welcome to another episode of Psych Talk. Today, I will talk about choice theory and reality therapy. So, reality therapy will be the application of choice theory. So, choice theory is just the theory, and reality therapy is the application of that theory. So, reality therapists believe that the main issue for most clients is a lack of satisfying relationships or a total absence of meaningful connections. We are obviously social animals, and all of us need to feel part of a community. We need friends. We need, a partner. We need to feel part of a family. And obviously, many clients um, struggle to, I would say, form close relationships, and which, often leads to feelings of unhappiness. So, in this case, the therapist's role is to guide clients toward healthier relationships and encourage more effective behavior. And as clients improve their relationships, they have a better chance of finding happiness. Clients often don't realize that their unhappiness stems from their own behavioral choices. Instead, they only feel pain or distress um, without really looking at what they're doing, which is causing their pain and distress. Glasser, which is one of the pioneers of this theory, argued that diagnosis should be avoided unless required for insurance purposes, as basically he viewed them as just descriptions of the behaviors people adopt to handle the pain from unsatisfying relationships. And basically, if the client does not have insurance, you definitely do not need to um, diagnose anybody unless they ask you to, you know, maybe they ask, okay, do you think I have this mental disorder, etc. But because insurance requires you, like, in order for the client to be able to um, come to therapy, let's say they have insurance, um, in order for them to like use the insurance, the therapy has to provide a diagnosis. Otherwise, insurance won't cover the therapy sessions. Okay, so let's talk about a little bit about choice theory. So, choice theory obviously serves as the foundation, suggesting that humans are inherently driven by five different needs, which is survival, love, and belonging, power and freedom, and fun. So, love and belonging are seen as the most essential needs as they impact the ability to fulfill other needs. Our brain acts as control systems, prompting us to satisfy these needs and avoid negative feelings. So, reality therapists help clients identify unmet needs and work towards fulfilling them by creating a vision of a satisfying quality world. And in choice theory, all behavior is intentional and made up of actions, thoughts, feelings, and physiology. And reality therapy focuses on helping clients take control over their lives by making better choices. And reality therapy really focuses on the present instead of the past. So when the client comes to therapy, the therapist wants to focus more on in the present and what we can do uh, to make our present better based on what has worked in the past, but we do not talk about like um, what happened in their childhood or the past in general. We're just focusing on the present and how to make the present better so that our future is going to look a certain way. And what reality therapists do is to try to make the client engage in self-evaluation type of attitude or some sort of introspection. And some questions that they may ask are, is what you're choosing to do getting you what you want and need? Or how would you most like to change your life? And what do you want in your life that you're not getting? What would you have in your life if you were to change? What do you have to do now to make the changes happen? And obviously, the role of the therapist is not to make an evaluation for clients, but is to challenge the client to examine what they're doing so that they can make better choices. For example, let's say that um, there's a client who wants to get closer to, I don't know, maybe his family or friends, whoever. A question that a therapist might ask is what you're choosing to do bringing you closer to the people you want to be closer to right now? Is what you're doing getting you closer to a new person if you're personally disconnected from everyone? And so these questions are just going to help you self-evaluate yourself better. And so, as a summary, reality therapy is a therapeutic approach that emphasizes the importance of personal choice and responsibility in creating a fulfilling life. At its core, reality therapy teaches that we are in control of our behaviors and that the choices we make play a crucial role in our well being, which is kind of similar to the existential therapy and Adlerian therapy. It has some of their flavors, but it's also different at the same time. And according to choice theory, which is basically the theory of reality therapy, we're motivated by five basic needs, as I said before: survival, love and belonging, power, freedom, and fun. And the theory highlights that we cannot rely on others to meet these needs. Instead, we have the power to make choices that align with achieving personal satisfaction and happiness. And a reality therapist works with clients to explore how their current behaviors and choices impact their relationships and happiness, rather than focusing on past experiences or external circumstances. And therapy centers on present actions and solutions. And the clients are encouraged to evaluate their actions and ask if they're truly helping them connect with others and meet their needs. Also, reality therapy is just that. By consciously choosing effective behaviors, individuals can improve their relationships, gain more control over their lives, and ultimately lead happier and more fulfilling lives. And basically, this approach reinforces or is telling us that while we cannot control others or we cannot control our past, we do have the power to make choices that shape our future. And that is the end of the episode. Thank you for listening.